said that Mr. McKissack was very organized, and he obviously had superb records of all his patients.
He had a very good secretary. She was always running about, always on the run. She would never walk. She would be always on the run. A little wizened person with strong glasses, but a loud voice and extremely efficient. And Mr. McKissack made it a point to write to every single person or hospital that referred patients with a full documentation. So that he had established communication. And then we used to have weekly brain-cutting sessions with neurology. So that really kept us very much up the mark, on the mark. And there's so much to learn from brain-cutting sessions. They were the most educative sessions that we could possibly ever have had. I don't think I can give any message. They know so much more about it than I do, because with the immense increase in the technology and all that, they're taking full benefit of it. And present generation, I think, is very much with it, unlike us who were. The present generation, I think, knows no limitations, excepting finances. If you have the money, you can have the theatre that you want, you can have the equipment that you want, if you have that. It all contributes, I think, to better work, safer surgery, yes. I think with specialization, you have to form smaller groups and intensive study of cases of your group, of the particular group that you belong to. And that is what's going to lead to progress, yes. You have to have intensive study into each area, each field, I think.
Yes.
It's much too complicated for any one mind to comprehend or to control.
No, I think it's important for them to know that once upon a time, what they take for granted today just wasn't there.
Yeah.
And even under those circumstances, wonderful work was done.
Yeah. But they should read about the greats. They are the ones that, like Cushing and Leahy. I didn't want to take any kind of office because I wasn't sure I would have the, the time or the patience for it. I think Sunil was the best thing that happened to KEM.
We had Dr. Nagpal also there.
Yes, yes.
And then Dr. Karapurkar joined.
So it was a good team. It was a good team. And you got on and you did.
That is what made it tick.
And then we had a number of residents, good residents. My feeling is that there should be a general all-round training in general surgery. There should be some amount of, because general surgery is you are involved in that. In many of your procedures will be in that. So you need to have a general background, and you need to have a exposure in a place or in a hospital where you get wider exposure to the different areas of neurosurgery where people function. And not only that, but most important, you need to be a neurologist first. Because if you're not a neurologist, if you're not thinking of neurology, you're looking at your patient only with a blinkered eye, then I think you're making a big mistake.
I think he would not even just look at the body, but he'd also look at the family, the context, the people, the empathy that he had with their lives, how much time he would spend on each patient, talking to them. He would leave the family to the door.
The problem is that many of us, I would say most of us, have a need to have someone whom we respect. We have a need for that. Almost all of us need somebody whom we can respect and whom we can show respect to. And I think this is one of the prime purposes of orations. That we have somebody whom we respect and who is usually universally respected. And we want that to remain in consciousness. We want other people, succeeding generations, to know that there was such a person who did this kind of work. It's a way of remembering somebody who is admirable. The honor is done to the institution. He has always been very conscious of duty. For him, duty is a religion. It's a religion, really. I mean, what other people talk of as religion is duty for him. On that occasion about the silver bars, it was a Parsi patient on whom he had done a laminectomy, who after he went home felt obliged to give Dr. Dastoor a gift. And he had actually brought a box of mithai, which your maidservant had accepted, because it's just mithai. But then the next morning, because all of you had gone out, when he felt that box of mithai, it was too heavy to be mithai. And that's when those silver bars were detected.
Right.
So he came to the hospital, which was the time for the outpatient clinic, and he just said, at about 11 o'clock, I need to go out for an hour. Wrote out a leave application for 1 hour. Looked up that patient's address in our register, went, delivered those, and came back. He's that conscious of duty. He would not have come home by 4 o'clock. Ginde was sitting on the chair, on the sister's table, and he had some papers in front of him. He looked at me, he's saying, I'm about to teach Dr. Narayan how to write an operation note. Would you like to learn along with him? I said, yes, sir, of course, because I knew that he was famous for the way in which he wrote his operation notes. Sit down. So I sat down. Narayan, sit down. He sat down. And he started. And he started explaining each part of the operation and why it should be written. Pre-operative findings, history, physical examination, ventriculogram, or whatever it was. He had just finished an emergency operation. And he was going to write the operation notes. That's why he called us. Pre-operative diagnosis. What operation was done? Then what was the incision that was made? Then the entire procedure of the operation. What was the post-operative diagnosis? Because it may be different from the pre-operative diagnosis. What is the expected course and what is the treatment you are giving? Slowly, and he had a very neat handwriting. He filled every one of, there was no printed column. He was making his own headings and he was writing his own operation notes. From that day onward, my operation notes changed. While I was an intern and as a houseman and as a registrar, all these meetings were always attended, Saturday meetings. And I used to see Dr. Bhatia and Dr. Gajendra Singh, of course, because they were from my institution. But I used to see Dr. Dastoor and Dr. Daftari, Vijay Daftari, who was the head at Nair. And of these, although Dr. Gajendra Singh was my teacher, and I am indebted to him heavily, I was tremendously impressed by Dr. Dastoor. Dr. Sidhwa was the neuroradiologist for JJ Hospital. At these meetings, he would put a picture and he would say, Homi, Dr. Dastoor's first name is Homi. Homi, what do you think this X-ray shows? I'm a little puzzled, I'm not sure. Honestly, he would say, I'm not sure what it shows. And Dr. Dastoor would look at it and say, I think this is what it is. And then Dr. Sidhwa would say, okay, fine. So the neuroradiologist from JJ would consult Dr. Homi Dastoor on neuroradiology when there was a problem. That was the level of excellence. Dr. Dastoor, even at that time, as an undergraduate, as a resident, was tremendously impressive. First of all, he never spoke. He never spoke until he was asked, Homi, what do you think? If it was his meeting in KM, then he would speak because it was his patient. But if it was JJ or Nair, he would keep his mouth shut till he was asked. When he was asked, he would get out and in a very short period would summarize everything and say what he thought was the problem and what was the solution. And 99.9% of the times he was right. Dr. Dastoor desperately needed a neurologist because of course Dr. Barucha and Monkar were there, but Dr. Dastoor was alone. He had no assistant. He had just one registrar for a long time. Dastur, one registrar, one houseman. That's the whole department. The entire department consisted of these three people. Registrar and houseman are trainees. So anything that has to be done, Dr. Dastur has to do it.
Yes.
Very early on, there were so many lessons to be learned from Dr. Dastur. So many lessons. And his records, again, are unparalleled throughout the country. Nowhere in India will you find this kind of record system. With Dr. Dastur, the summary was 10 times more detailed. And it was in text.
Yes.
And it was indexed so beautifully that within 5 minutes of a patient coming, whether he had come in 1957 or whether he had come in 1977, you could pull out everything. Case paper, operation note, pathology report, folder. Everything. 5 minutes, that's all. No computers.
Sure.
There were registers, and they were alphabetical registers. And he started this in 1957. When he started the department, he started this system. Imagine the far-sightedness of the man. If you ask him today, he'll tell you, oh, but that is what I saw in Atkinson-Morley, so I just used this technique. Barabar hai, you saw it in Atkinson-Morley, but nobody else was doing it over here. If any credit is due to the Department of Neurosurgery at KEM, there's only one person who is responsible. Because all that Dr. Nagpal did, or Karapurkar did, or I did, was just to continue what he had started. There's nothing great in that. But all this was thought of and started on a firm footing by one man. We had a cardiac physician, Dr. K.G. Nair. At that time, there were two posts of directors, which were above professor. And the director had professors under him. Director, professor of surgery, P.K. Sen, director, professor of medicine, K.G. Nair. K.G. Nair moved in high circles, academic circles, and he knew Dr. C.N.R. Rao, who was given the Bharat Ratna. Now, we have no super VIP arrangements in Department of Neurosurgery. But he said, I want you to treat him. You know, he's very, he didn't tell us who he was. He's a very important person. You have to treat him. So, okay, let him come here, we'll treat him. And he brought C.N.R. Rao. Now, at that time, C.N.R. Rao was director of Indian Institute of Science. He had been honored by about a dozen universities abroad with doctorates. Oxford, Cambridge, or whatever. Big university had honored him. He could have gone anywhere in the world if he had chosen to go. Anywhere. Anyone would have treated him with great respect and great honor. But because K.G. Nair said, come to KEM, he came to KEM. And I requested Dr. Nagpal, I said, see, this is a pituitary tumor. He had acromegaly. Pituitary tumor. Please treat him. So Nagpal took him over immediately and examined him, history, everything. Explained everything to him, what was to be done. And to our intense surprise, C.N.R. Rao said, okay, you can do it here. I'm willing to get it done here. Now what VIP treatment can we give him? So we gave him a side room with a curtain. And there was a bench over there where his wife could sit. Now this is not what he's accustomed to. You know? He's accustomed to a deluxe suite. But he didn't say a word, neither he nor his wife. Never, not one word. Dr. Nagpal did the operation, removed the tumor, acromegaly went away, and to the best of my knowledge, up to now, it has never come back. When I was admitted for the disc, I wrote a little note, which I gave Dr. Nagpal. He may tell you this if you ask him. In that note I wrote, because I had to undergo general anesthesia, and this was a disc operation, and as you grow older, there's always a likelihood of complications. Although everything was normal, ECG, echo, everything was normal, but still. So I said, in the unfortunate circumstance of there being a catastrophe, if I am left severely brain damaged, with no prospect of any sensible life, I request that the following steps be followed. No resuscitation. I don't want an endotracheal tube, I don't want vasopressors, I don't want all that. Then I will die. When I die, I want my body to go to the nearest medical college hospital for dissection to be given to the first MBBS anatomy students. I do not want any funeral ceremony. I do not want any religious ceremonies. I didn't show this to my wife. She probably doesn't know about it even now. But I gave it to Nakpal. I said, look, if this happens, it's your responsibility to follow this. Whatever organs can be used should be taken and used. The first thing is, don't quarrel. No matter what the provocation, don't quarrel. It doesn't help. First of all, it sours the entire atmosphere and you don't achieve anything. So don't quarrel. Whatever be the provocation, try and be sensible about it. Try and make it up if it can be made up. If it can't be made up, ignore it. But don't quarrel, don't fight. And then the second lesson, of course, is try and do as much good as you can, wherever you can, in whatever way you can, small, big, whatever. Try and be good, benefit other people. Because you have been benefited in so many ways during life, by your parents, by your friends, by your relatives, by your teachers, by your employers, whoever. It's time that you should also repay. So whatever chance you get to do good, do good. And as far as doctors are concerned, I think it's important for every doctor to realize that he is a professional as Tuttle had defined it. Other people also must have defined, but Tuttle's description comes to mind just now. And secondly, in the olden days, in the days of Charak and Sushrut, if you read the Samhitas, they tell you that they used to select medical students. Anybody and everybody could become a medical student. And the selection was not made on the basis of you're a Brahmin or you're a Kshatriya or you're a Sudra. The selection was based on the basis of how much you want to become a doctor. How much do you want to help the patient? And the prime purpose was that you wish to benefit people who are ill. That is your prime purpose. And I think that principle should be there till the end of time. As long as this planet exists, that should be the fundamental principle. A doctor is there to help his patients. And there is this golden rule, do unto others what you want others to do unto you. And in a sense, you can modify Gandhiji's statement. Gandhiji has said that whenever you are in a dilemma about any course of action, think of how this will benefit or harm the poorest person in this land. If it will benefit him, do it. If it will harm him, don't do it. Same thing. Any step that a doctor wants to take, whether it is a test, or whether it's a procedure, or whether it's an operation, or whether it's some drug therapy or whatever, if you were the patient, would you like this to be done to you? Will you appreciate this being done to you? If the answer is yes, do it. If the answer is maybe or no, don't do it.
The neurosurgical staff, the neurological staff, the neuroanesthetists, all of us are working towards creating an ideal neurosurgical setup. Even now, I think people who have been trained in the older method would still see the patient as a whole. The amount of information that you would see in Dr. Pandya's notes and a little lesser to my notes is a lot of information which would probably be considered extraneous. But one, it is the training that is difficult to give up, and there is a sense of an incomplete deal that is being offered to the patient by zeroing in on only the thing and ignoring some other things which could be important and which the patient himself or the referring physician hasn't realized. everything that the patient is telling needs to be heard. Sometimes you may have to cut short a patient who is really meandering too much and you redirect the patient. But it is good to be able to listen to the patient, and that can only come in private practice when you say to yourself that I am going to see 2 or 3 patients at a time and not going to see 8 or 10 patients in a neurosurgical or neurological practice in a period of 2 hours, which I think is doing injustice to the patient. I am concerned that I feel that I am not doing justice to the patient if I don't hear the patient and at times picked up hints which help to treat the patient. I would say if we are in the profession of treating patients, my ethos is that the patient comes first before anything that is happening personally or privately with me. I encourage patients that please don't hesitate to call, and it does not matter if you think it is urgent. You can call at any time of the day, be it at 4 a.m. in the morning or early, say 1 o'clock in the morning. I will certainly respond to the call and try and help you. If I even have got irritated at a person, I tend to tell myself that this is not correct and it is that person's understanding of his problem. I just have to try and ease his mind.
See, first thing is you should have a passion for what you are doing. If you are in a position where you can confine yourself to doing a specific aspect of neurosurgery, I think you should develop it. If that is not possible, like for instance, if you are in Nasik or in Sholapur, or you can't do that unless you can somehow get people together, form a group, then it would still be possible. So you could still do, everybody do general neurosurgery, but each one develops his own niche area, because that is how the world will progress. If you are doing tumor surgery, if you are doing vascular surgery, if you are doing functional surgery, if you are doing epilepsy surgery, I think that is how the world will progress. Number 2 is always have an open mind. Never say, "Arey, kya bol raha hai, kya sikhayega hame." Even from the junior-most resident, you will learn something. Always question. Never accept something just because I am saying something, I am gospel. You should always go and cross-check whatever you may have been told. And as we grow, we develop our own expertise. I think we should not do things mechanically. That's another very important thing. Even the same operation which you may be doing every day, you should always think, could I have placed the borehole here? Could I have made the dual incision differently? At the end of the day, one should always ruminate about how the day has passed and whether he could have improved upon what has passed. I think that is again a very important thing. And finally, we should attend meetings, because take for instance what you are doing. If you are doing a niche area, you won't learn from anybody in Mumbai, which means you will only learn if you travel abroad or wherever, but go for a place where you will learn something different. If you are in a situation where you are doing everything, even so, you should attend meetings and not confine yourself to what you are doing. Tomorrow you may have a patient, say for instance, with a giant aneurysm, for which endovascular treatment is the only possibility. So you should know where to refer the patient.
Sure.
Especially in Mumbai, there is no problem, but when you are outside Mumbai, I think therefore it is important to attend meetings not only of your interest. Of course you should attend of your interest, but also of other specialities. Most important is think positive and keep an open mind. And always try and learn something. The day you say that I know everything about this is the day your deterioration starts.
Ambitiousness which was there still roars in my blood. Neurosurgery was what I liked and what I did and what I thought and what I dreamt. KEM has been an institution of pride for people who have worked here and people who know KEM. The students who have performed here, the students who have learnt, have taken KEM flame out throughout the country and throughout the world. So we are proud of KEM. As for me in particular, it is the greatest subject I could have imagined. Neurosurgery can change the lives of individuals. Neurosurgery can make a person or break a person. It depends on personal training, personal commitment, personal attitudes, personal ethics to do good neurosurgery. More important than all these things is personal philosophy about the subject. How you think about a particular issue and how you mold that issue into clinical practice. Nobody in neurosurgery can be above the subject. You always remain student and you always remain under that umbrella. We have to think about the subject, we have to think about the patient, about the betterment of the patient, about the life of the patient. We are meant to sacrifice, we are meant to commit, and we are meant to perform. Dedicate to the subject, dedicate to the patients, dedicate your life, and you will become a happy man. Here there is commitment, here there is labor, here there is hard work, here there is agony, here there is failure, here there is patients who become morbid, family who start having emotional issues. Then of course if you want to go beyond a line, then you have to focus, you have to work hard, you have to write papers, you have to think about innovations, you have to think about new ideas, you have to go into newer ventures, you have to think laterally. It comes by commitment, it comes by hard work, by absolute dedication to the subject. Alumni association that you are making, I think this is a good opportunity for our proud young neurosurgeons from all over the country to get together, to talk about their achievements, to talk about their glories, to talk about their difficulties and to talk about their failures. To sit down together amongst their brothers and amongst their colleagues and amongst their teachers and amongst their friends and talk aloud and think aloud, where they are king in their own right, but that king is a little bit lonely. So when the kings get together in this association and when the kings discuss with each other, I think the kingdom will grow and the love and affection will grow, and more importantly, respect will grow for the individuals and for the subject. I wish that neurosurgery grows further with this association. Contributions to the Indian neurosurgical scene grows from this association. Mutual respect grows and neurosurgery grows.
Ni re ga, ni re sa, ni re ga ma ga re, ni re ga re, ni re sa, ni re ga ma pa dha ni sa, ni da pa ma ga re, ni re ga re, ni re sa. जय शिवा हे गंगा तैसे जाचे मान भगवंत जान. This is totally laziness. Circular automatic saw, and there is a particular technique which I should have asked, which he would have told me so easily. I saw those carpenters using that. So I just went to Lohar Chal one day and I bought that. But I had never used it. So I used for the first time. It slipped and it took away my thumb. पु ल देशपांड्यांचं एक वाक्य आहे की तुमचं जे काही नियमित काम असेल ते इमाने इतबारे करा त्याच्यामुळे तुमच्या 2 वेळच्या जेवणाची सोय उत्तम होईल. पण त्याच्याशिवाय तुम्ही संगीत, साहित्य, खेळ याच्यापैकी कुठल्या तरी गोष्टीशी मैत्री करा. आय गॉट दिस आयडिया दॅट देर शुड बी समथिंग स्पेसिफिक, समथिंग unusual. So I thought that somebody partying, or suppose you have passed your MCH neurosurgery and you are going out, so you should get a farewell plate where there is something representing brain and a small message, or just a small message to wish you. I got defeated and I given up. Our profession has not remained a profession. It has become business, and business of worst type. I have learned only one thing from my teachers, that don't be a crook, so one crook less.
गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरः गुरुर्साक्षात् परब्रह्म तस्मै श्री गुरवे नमः. गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरः गुरुर्साक्षात् परब्रह्म तस्मै श्री गुरवे